Subscribe to One India channel and never miss an update. Hi, thanks for joining in to this One India live session. We are headed towards what could possibly be another COVID-19 peak. Cases have been surging day by day, and a new round of curfews and lockdowns are being imposed across the country. Now, what is happening and what are the next few months going to really look like? To shed light on all of that, we are being joined by Professor Sashikumaar Ganesan, who is the chairman of the Department of Computational and Data Sciences, IISc. Thank you, Professor, for joining us.
Thank you. Thank you,
Professor Ganesan. There is a lot of fear and panic and now even fatigue with the ongoing pandemic. I have a couple of questions to begin with, sir. And those are that, how did we get here? Could this new surge of infections have been prevented? And did we really see it coming?
Okay, so this is a kind of a second wave, right? Everyone is now accepting that this is a second wave. So the surge, especially in the last 2 weeks, 2 to 3 weeks, it has started like 3 weeks back, but the surge is really, compared to the previous year, it is really very steep. So what we are seeing is that despite we are having the vaccination drive and as well as the serological factor, right, the immune, all these things, but unfortunately we do not have the lockdown measures like last year. Whether it's good or bad, I'm not going to the debate, but still eventually the social distancing is not effective as previous years. So that could be one of the reasons why the spike, especially in the last few weeks, there could be several reasons for it. So few states elections are going, a lot of rallies, and there could be some other functions and other things. But mainly I believe that, of course, one is like a mutations, different variants, but social distancing is the key factor that I think we are missing.
All right. Sir, I mean, you are studying infectious diseases, epidemiology. Is this expected, this wave after wave of an infection?
Yeah, this waves coming, second wave, third waves, these are like the usual phenomena. I don't think we can completely ignore that. Even the previous history also shows that second wave, third wave kind of thing. But all these things are preventable. But again, the COVID is a new virus, and then we don't have any history of the COVID. Though the expectation was there, but the spike is a little unexpected, and it's too steep than expected, at least from my point of view.
All right. I don't know if it's too early to ask this question, sir, but what difference are you witnessing in the current COVID wave in terms of distribution among population as compared to the last?
Okay, so in our model, we mainly do the computational model. So in the model, we do compute for different states, and then put together, we are coming into the nation. So that's how our computational model works. So what we have seen is more or less the pattern remains similar. For example, Maharashtra, where Bombay and all these places have affected severely in the previous wave. Even the Delhi initially got affected, right? And then the Karnataka was also affected. So similar trend I can see. It's not nothing new. Wherever we have more urbanized sectors, we are seeing more surge in the wave. So I don't see much difference in terms of the pattern, but maybe here and there plus or minus a few numbers. But the dynamics, from my point of view, compared to the previous year, it's almost similar.
All right. So now, previously we didn't have much information about the virus. The way it was infecting people was more mysterious then. But now do we know enough about it to know its behavior and how it's going to spread in the population? And based on the model you have made, do we have the data? Can we fine tune the data that we already have? And do the models that you have come up with, can they now inform our decisions going ahead in how to open up workplaces and how to open up schools and colleges?
Yeah, so the model that we are, maybe I will maybe 2 minutes I will take to explain about the model, then makes clearer so that it will be useful for the entire interview also. So our model is a high dimensional, the multi-dimensional model, so which includes several parameters. One key parameter is the social distancing, and then the interactive index, and also the severity of the infection, and also we have the age of infection and age of population. So these are parameters which go into the model. So in addition to that, so in the updated model for the second wave, what we have included is we have included the prevalence factor about the serological survey of 20x, 10x, all this prevalence factor that you have included, and as well as the vaccines that per day, that how many we are administering, that those numbers also included into the model. So basically, these are the parameters or the variables that go into the model. So these parameters, for example, in the wave 2, what we have done is we have fine-tuned these parameters even for the previous year. So we had used the data from March 23rd, 2020 till around September. We have used these data to fit these parameters. And then what we are doing is, so we are just varying the social distancing one based on the previous data and fit it, and then interactive index. All these things are fitted based on the previous year data. That means the dynamics will be similar, but the numbers could change. So how we are changing the number is mainly comes into the terms of the serological survey. So in case if you have like a 20x or 10x, so what I mean about the serological survey and then 20x. So for every reported case, when it says it's about 10x, there are 9 unreported cases. That's what we call it as a serological survey or the prevalence factor. So 10x I'm calling. So similarly, 20x when I call, there are 1 reported COVID case and 19 unreported. Though unreported is not good, on the other hand, in terms of the spread, it is good. The reason being these 19 unreported cases are already having the antibody. I'm not going to the detail about the mutations, different variants, reattack, and all these things. That will be very negligible number. So whenever we have the more and more X factor, prevalence factor above from the serological survey, that means susceptible population will reduce. So once we have once we reduce the susceptible population, then obviously the spread can be contained. So I would say that here the social behavior and the social distancing, everything is not really in the standard that we are expecting. But these factors, this antibody already those who are having, and as well as the vaccination, these are the things helping. But definitely we need to have a clear-cut policy of containing all these spread and other things from the government.
Talking about policies, is India in fact making an informed policy decision? There was a lockdown which helped curb infections, but going forward, when we started opening up, and very recently, I think offices also had begun, and schools, they were taking decisions on reopening of schools. Were those sound policy decisions, or should we have had science informing our decisions and done better?
For example, when you talk about I will start from the lockdown. So when you talk about the lockdown, so lockdown alone will not suppress the spread, right? So it's only like slow down the spread. Unless otherwise you bring in the change, especially how the functioning of all private sector, government sector, schools, colleges, everything, right? We need to bring a policy, and that policy should be like a long term. That should not be like overnight. You come and say today, like tomorrow we are imposing the lockdown, night lockdown, all these things. That's not going to help. That makes even panic. And then because of the panic, everyone will rush to the shop to buy grocery and other things, markets, right? And it's really vulnerable. Then they will get more and more vulnerable, and there high likely chance that the spread will spike. So what we really need is a long-term policy for 3 months, 6 months, 1 year. Even if it is getting better, of course, you can here and there you can tweak and then relax. But the policy and the plan should be for at least an year. What will be for the policy for opening schools? What will be policy for opening the colleges, right? And also what will be the working professionals? When can go? When can come out? For example, the private sector, those who are working in IT companies, they can work during the nights, provided. I'm not saying that everyone should go and work. And also they can work from home. So all these policies should be consultant with state government, central government, come up with the policy. For long-term policy, short-term policies might slow down, but not going to help. That's my personal view.
What's your verdict on the current lockdowns and current curfews that have been imposed? Is this going to help?
Especially the night curfew, its effect will be very minimal, right? The even if you don't have the night curfew, maybe you can say that the pubs and then the other restaurants and other thing you are reducing. On the other hand, the people, those who are really infecting, they're not really traveling in the night. So if you take the percentage of the people, those who got infected, you have to check whether they have traveled during the night to see that whether they impose the night curfew so that get an effective way. I don't think they are most of the people. If you, unfortunately, we do not have the data, but even if you take the data, I don't think this is the case. It comes from the travel, it comes from the market and workplace, colleges. So we need a policy. Just imposing the night curfew, and then some governments are coming with the policy, and then few days after some party goes and imposes, no, you should not do that, then they revert the policies. And these are kind of things definitely not going to help. The government will be working only on the policies, not on the real task of the kind of preventing the or containing the spread.
Right. Do you see this situation settling down? Do you see, the scientists who have the data, who have the ability to interpret it, working with the government to make policies anytime soon, or are we just going to? Is this cycle just going to repeat?
No, I think every government, including the state and central governments, they are already having the committees. Experts are part of their committees. It's all about the implementations and the long-term policies, right? The inputs are going from the experts. I'm not saying that the government is not listening, and they are getting the inputs from the experts. But only thing is implementation. So implementation part, and as well as the policy point of view, I think there should be a uniform policy across India, because we do not have any travel restriction across the states. For example, Tamil Nadu elections just got over, and I don't know whether you have followed it or not. The last 1 week or 2 weeks, right? Wherever you go, it's a kind of full rally. I don't see any restriction on the rally. On the other hand, Karnataka, we are imposing all the restrictions and other things. What is the use? People go there and come here, and then it's enough to get spreaded, right? So maybe the government should think of elections. Even the election, they could have postponed it. That's my personal view again.
Right.
We need a policy. That's what I'm saying, right? So no gathering for 1 year. You impose the policy and maintain it, and informed decisions well in advance. This is what really we really need in India.
Right. So what happens next? Now there's a mutant strains of the virus. India has a huge population. How does this infectious disease end?
I don't think anybody can answer or say that how to end it. If anybody knows, then we could have done it even the last year. So only we can prevent and slow down. And if you are able to break the chain of spreading, then that would be enough. So, for example, again, people have to pitch in, right? At the end of the day, it's our government can bring in a lot of policies. If the people don't follow the mask use of hand sanitizing, masking, and also avoiding attending group meetings and other things, it's nothing going to help. So I can, for example, on an average duration of the COVID is around 25 days, 30 days. Then after 35 days, either you got cured or you go to the extreme stage. For example, even previous year, if we had, even though imposed the lockdown, everything very strictly, if everyone had followed these lockdown procedures, then at the time itself, we could have completely contained the COVID. But that was not the case. It's keep on, even during the lockdown, it got spread and spiked. So which means that somewhere something is going wrong at the implementation line, we are missing something. So in my view, it's very difficult to say when it's going. We can only say that these are the trends. Maybe next 2-3 weeks, we can definitely predict how it's going to happen. Compared to the previous year, what we are seeing is probably by end of April, the peak might come down. When I say it's a peak, it's number of active cases might come down, provided we follow the similar social distancing as previous years. There is a high likely chance that it's going to come down, or the peak is going to end by mid of April.
Right. So even the government has said now that the next 4 weeks, I believe, are very critical. Why is that, sir? And beyond that, is there hope of things perhaps getting better?
Yeah, so at least I do not want to go into the why government and based on what data, but from our data, I can see even our data also, our projections also shows the similar trend. I can say why. So the main reasons, for example, if you look at our curves, and it's available on the website, one can see it for India as well as for the individual Karnataka states district wise. So what we can see is the mainly several things are coming into the picture, but the main thing is one is the prevalence factor again, so 10x, 5x, whatever. So that makes the susceptible population less when you move forward, and also the vaccination. So vaccination, I do not want to again pitch and go into the topic of efficacy and other things, but even if you put 70%, this is what we have included, including the second dose. So when you say it's like 30 million vaccines, and then we are taking only the half of it to account for the second dose and also the 70% efficacy, then we can see that those numbers are keep on adding, and then this will help to prevent, because the susceptible population number will reduce. Whenever the susceptible population reduces automatically, in addition to the recovery and other things, automatically the spread is going somewhere in the mid second or third week of April, and then towards the end of April it's coming down. This is what we observe from our model. Probably the government will also might have also seen similar patterns. That could be the reason why the government says that next 4 weeks are crucial. But again, caution, our model is mainly about we have to follow the strict social distancing, because our parameters were fit based on the previous year dynamics. Previous year dynamics includes lockdown.
Right, sir. Thank you very much, Professor Ganesan, for joining us on this interview. And for our viewers, if this video informed you, don't forget to like, share, and subscribe to our channel. Thanks for watching.
Thank you very much for hosting me.